Well, we welcome our esteemed guests and we look forward to having a great day with them today. And to our viewers, this thing no be just show, this no be talk. It's a movement, it's a strength, it's love. Understand? So stay tuned with us. And our motto for today is be proactive, be aware, and can you give us a brief definition of what breast cancer is?
Okay, so simply put, breast cancer is a malignant tumor of breast tissue. That's basically when there's damage to the normal healthy DNA of breast tissue and then they begin to grow out of control. That's basically what that is.
Who and who are at risk of this breast cancer?
Okay, so simply put, everyone is at risk of breast cancer, male or female, young or old. However, there are certain risk factors that predispose some people to breast cancer. So, but everyone is at a risk of having breast cancer. But then if you're a woman, especially, if you're above the age of 40, 50, you're more at risk of developing breast cancer. If you have, a family history of breast cancer, especially if you have a close relative, a first degree relative with breast cancer, you are at greater risk of having breast cancer. If you have certain genetic mutations, and your reproductive history also matters, because if you started your menstruation very early, or you got to menopause very late, or if you've never had a full-term pregnancy, you're also at a greater risk of having breast cancer. There are also other factors that predispose to having breast cancer, like alcohol, smoking, your health, obesity, and all these other factors.
I'd like you to tell us about the signs, the early and the late signs that will help in early detection of breast cancer.
For you to be able to detect these signs, you have to have already been familiar with the normal structure of your breast, so you can easily detect when there are differences. So the early signs you might see some changes in the size or the shape or just the appearance of the breast on inspection, in a mirror or something. You might also notice some skin changes around the breast and see there might be some redness, there might be dimpling. When I say dimpling, what I mean is some kind of indentation on the breast tissue. There might be flakiness. The nipples might also, be producing discharge. There's not necessarily milky, maybe bloody or clear discharges. It might be cracked, it might be inverted. The nipple normally stands out, but then it might kind of go back inside. So these are some early signs. And most importantly, you might feel a lump around your breast. So when you touch your breast, you might feel there's something that is not a lump. When I say a lump, just something that feels something new, something that feels new, something that's not normally there. And like I said, for you to be able to identify that there is a lump, you have to have already been familiar with the normal structure and feel of the breast. So these are early signs. But if we're talking about late signs of breast cancer, you might start losing a lot of weight. You might also notice a lump that is now more mobile. Now more immobile, like kind of more fixed breast tissue. You might notice, swollen lymph nodes. When you touch around your armpits, you might notice like there are these lymph nodes that feel swollen, or around your clavicle. You might also have some other signs of other systems, jaundice, headaches. These are late signs, ulcers, sores, and all that.
All right, thank you, Mr. Bon. You have heard what you say. Awareness no be just for alone. Awareness and a lifestyle. You understand? A person with breast cancer doesn't mean that the person's life has been
Absolutely no. Absolutely not. The diagnosis of breast cancer in a person is not typical like or automatic certification of the person's death or the person's death. In fact, with the advancement in screening, early detection and treatment of breast cancer, people can survive for many years even with the diagnosis of breast cancer. There are three important things to know to understand that in the kind of saying that breast cancer diagnosis or diagnosis of like breast cancer is not the end of someone's life. Number one is that there is a higher survival rate of people with breast cancer. The most important thing is that there is early detection. The staging and the stage at which breast cancer is diagnosed is important. The ones that are like kind of diagnosed early at the time, like poses a very good prognosis, has a very good prognosis. People can survive, like the survival chances is up to 80%, 90%, depending on the time or stage that the diagnosis is made. Even those that have reached stage 4, like metastatic stages, people they can still kind of live for a very long time with proper treatment and management of the side effects. And then there are like modern inventions, there are like modern innovations in the treatment of breast cancer. We have surgery, we have radiation therapy, we have chemotherapy, we have immunotherapy, we have hormonal therapy. And these therapies, like when they are done properly and when they are being followed through, when there is a good compliance with this treatment, breast cancer is not an automation or a statement that somebody is going to die or that's the end of the person's life. So diagnosis of breast cancer is not the end of the patient's life.
So, Miss Rose, can you tell us the practical ways or the practical steps on the prevention of breast cancer?
Okay, that's a very good question. Just like my co-speaker said before, that there is no specific etiology to breast cancer. So here's what happens. It's like a multifactorial thing. Many things have to go wrong for a person to have breast cancer. And while there's no specific cause, there are ways to prevent it, of course. One of them is smoking. Stop smoking.
Well, okay, why must you add smoking?
Not the very nice. Even those that make smoke add the packet do not smoke.
What
do you
they
see
say?
there?
You must smoke.
They said smoking causes cancer. Should I buy one for you?
Serious?
Should I buy one for you? I'm going to go now.
You believe that? You
I
believe
believe that
smoking causes cancer?
yes, now it predisposes you to like cancer.
Yes.
But the majority of people that smokes are mostly male. Well, we are talking about breast cancer. Breast cancer.
Oh, I think it's because of the climate you live in. You believe that majority of people that smoke are males. Life is beyond Nigeria. Breast cancer is beyond Nigeria. And in other climes, it's almost an equal rate or occurrence of those that smoke. So yeah, smoking, it doesn't do anybody any good. Breast cancer, lung cancer, mouth cancer, name it. The side effect of smoking. So smoking, if you do that, cut back on, there is nothing good about it. Nothing at all. Another one would be to exercise more daily. Exercise never did anybody anything wrong.
Alright, please, I have a question. I have
Yes.
a final question. Say exercise daily.
Mm-hmm.
I can easily wake up from my house and then walk and take a little bit distance, right? But can you specify? Can you tell us the amount of time like necessary for the exercise? Do you mean is it 1 hour exercise? Is it 30 minutes? Is it 4 hours exercise? Tell us.
Scientifically, for exercise, you have to walk at least an hour every day. Absolutely. Now, as students in this school, I don't know, that is like a very good day for us. I have thousands of steps every day. If I count them, like, so I feel, no, I don't feel. Science has proven that minimum of 1 hour every day is enough for you to stay healthy. Or 30 minutes doing vigorous gym exercise. If you're not a gym bro, this is the science actually.
So you want all of us to talk to gym rats?
Yes, no.
I don't know, it's good for you, it's good for you.
Hey!
Why not? Why not? So yes, exercise is very good. The other thing would be to watch your weight carefully, especially if you are above 40. Now I'll try to break down the science very quickly. When somebody has so much fat in their body, there's a particular hormone we call estrogen. Now estrogen is produced primarily by the body. But then when somebody has so much fat in their body, like in case of obesity, there is exogenous production of estrogen. What I mean is that those fats also begin to produce estrogen. And estrogen is a hormone that's implicated time and time again in breast cancer. So watching your weight, especially when you're above 40, is actually really, really, really good to prevent breast cancer. Then healthy eating, healthy diet, it is very good. It's not just breast cancer, it stops a lot of diseases. But these are the practical ways in your own little corner how you can prevent breast cancer.
Alright, that was very powerful. You know, say they don't say knowledge will save life, no really get right. You know. So she said something about smoking and obesity and rest. But I would like to know about something. But if you tell us the practical approaches and the importance of early detection in this breast cancer. Can you tell us the importance of early detection in this breast cancer?
Okay.
Alright.
The importance of early detection cannot be overemphasized. In fact, awareness is everything. Now, here's what practically, whenever I go for postings and I see women in the world, the truth is that many of these people come when it's already late. It's like this thing we have in this country where we visit 1 million places before we think of hospital. So but then when you detect these cancers early, it's kind of like, let me see for example, let's say somebody has breast cancer, somebody's breast, and then this is just how small the tumor is when you come early. It's easier to just do a simple lumpectomy, which is removal of the lump, and take out this thing and maybe do adjuvant treatment like chemotherapy to ensure that everything is gone. Then when you come really late and it has spread all the way here, it's harder for the doctor to manage, it's harder for you to live with it. So early detection cannot be overemphasized because it determines your prognosis. The stage at which you have breast cancer or stage at which treatment starts matters very well. So yes, very important.
Wow, thank you. We have heard a lot of things tonight, and one particular question keeps coming up, which is awareness. Ms. Kosi, do you think that awareness can help in early detection and life-saving in breast cancer?
Absolutely, it can.
Alright, can you tell us how we can increase this awareness now in Nigerian universities and society at large?
One thing I know for sure is that students are powerful messengers. If you let them know better, they will spread it very fast. Now, we can do something like collaboration very, very fast. My norms are here now, and I'm sure everybody has seen October Fire going on now. It's the collaboration between the Medical Women Association of Nigeria, the doctors' arm, and the students' arm here in UNMSA. That flyer, compared to last year, has blown over the roof because students are involved. So collaborative efforts with students will spread the information around the student community so that people here can know the importance of early detection. They can tell their parents, tell their aunties, tell their moms, tell their patients when you even play. Anybody that tells me I've not heard of cervical cancer, I've not heard of pap smear, I'm like, okay, everyone is doing one on 25th of October. So I'm telling you now too. Next week Saturday we have a screening going on in the center. Another we can be through social media hashtags. Already in the advent of technology, everything can spread like wildfire now. So I think we should utilize the social media to go everywhere. Do market outreach, that's another way. Outreach like this underserved communities. Often I never have to go to Independence Day. These women know about breast cancer. So go to these underserved communities, tell them about breast cancer, speak your language, speak Igbo. That is where we are from. Tell them about it. Now come and get screened. It's not for only women. Let me see you there next week.
Serious?
Men get breast cancer, you don't know that.
What percentage of men do have breast cancer?
While breast cancer in men is not as common as in the women because women have more adipose tissue. So the more fat you have, the more chances that things can go wrong. But men have less fat, so things go wrong less. So it's a very minute percent in comparison to the women, but it's not new. So it's possible, it can happen with you. And we don't know until you go and get tested on Saturday. You know that?
Everybody.
So go and be sure. Harry, go and be sure.
Alright, we'll take a quick break now. No waka foul. G's two plates when we come back, you understand? Day jiggy.